Hello friends. So nowadays I have been receiving phone calls and messages related to medical coding. Sir, I want to learn medical coding. Where do I start? So in order to help the people who wants to enter into medical coding, I have been creating this series of videos related to medical coding. In today's video, we are going to learn anatomy of human integumentary system in medical coding. In this session, you are going to learn anatomy of the skin as well as common conditions related to skin as well as common ICD-10 CM codes we need to use for skin conditions. And also we are going to see few example scenarios related to skin. If you want to master integumentary system, please watch this video until the end. So as all of us know, integumentary system consists of skin and subcutaneous tissue. So skin is the superficial layer. Under skin we are having subcutaneous tissue. As all of us know, skin is the largest organ of the body. If you go to interview, they will ask you, what is the largest organ of the body? So there you need to tell them. So it is the skin which is the largest organ of the body. So mainly the skin has three main layers: epidermis, dermis, hypodermis. Epidermis is the outer layer, provides a waterproof barrier and skin tone. So whatever you see on the top portion of your skin is epidermis. So under epidermis we are having dermis, which contains tough connective tissue, hair follicles and sweat glands. Under dermis we are having hypodermis. The other name for hypodermis is subcutaneous tissue or superficial subcutaneous tissue. So which consists of fat and connective tissue and insulates and cushions, which is the deeper layer among these three layers: epidermis, dermis and hypodermis. So here hypodermis is the deeper layer of the skin. So if we see here image normal human skin layers, so topmost layer is the epidermis, next is the dermis, next is the hypodermis. So below the hypodermis we have muscle. So while coding CPT codes, these layers are very important. So you need to code based on the origin of the lesion. Okay. So why means if the patient is having the lesion, if the patient performs excision from these areas, based on areas we need to code CPT codes. Why means from integumentary system we are having separate set of codes. From musculoskeletal system we are having separate set of codes if the patient performs excision of lesions from these areas. Next we need to understand what is the use of skin or functions of the skin. So it will provide protection, sensation, temperature regulation, vitamin D synthesis, immunologic surveillance, wound healing, subcutaneous tissue, composed mostly of adipose tissue. So most part of skin is composed with fat, or other name for fat is adipose tissue. So and also skin stores energy, protects muscle, bones and insulates the body. So these are the functions of human skin. So now we will see common conditions related to skin and subcutaneous tissue. Most of the time we will encounter skin and subcutaneous tissue infections. So now we will learn few infections related to skin and subcutaneous tissue. First one is lymphangitis. So what is lymphangitis? Lymphangitis is infection of the lymph vessels. So lymph vessels are the vessels which will filter the unwanted fluid. So it is a type of secondary infection, which means it happens because of another infection. So bacterial infections are common cause and it may develop due to virus or fungus also. So here we need to divide this word. So itis means infection. Lymphangioma means lymph gland. So basically inflammation of lymph gland is lymphangitis. Most of the time lymphangitis occurs due to other infection. So here lymphangitis is the secondary infection due to other infection. So what are the symptoms of lymphangitis? Redness, swelling, pain or tenderness, fever and fluid dryness from the lymphangitis area. So how does the physician will treat this lymphangitis? So physician may prescribe antibiotics, analgesics, anti-inflammatory drugs, needle aspiration, incision and drainage. So these antibiotics, analgesics, anti-inflammatory drugs are therapeutic treatment. Okay. So needle aspiration and incision drainage are surgical treatment for lymphangitis. Now we need to understand what is abscess. So a painful collection of pus develop under the skin caused by bacterial infection is called abscess. So what you need to remember here? Most of the time abscess occurs below the skin. Most of the time abscess is painful. Next is furuncle, also called boil. Okay, is an inflamed painless abscess, cyst or nodule on the skin caused by bacteria, often staphylococcus, entering along the hair follicles. So if you see the abscess, patient will have the pain. Okay, if you see the furuncle or boil, physician will treat this furuncle or boil in another way. Most of the time you will see furuncles along with the hair follicles. Next one is a carbuncle. So carbuncle is a infection of the skin that arises from a collection of interconnected infected boils, usually from hair follicles infected by staphylococcus. Okay. So most of the time these skin infections will be caused by bacteria. The origin of this skin infection is most of the time staphylococcus bacteria. So boil is the single painful abscess, cyst or nodule on the skin caused by bacteria. So carbuncle is a combination of boils or interconnected infected boils, which is also caused due to staphylococcus. Next one is cellulitis. So cellulitis is an infection of skin and subcutaneous tissues, most often caused by staphylococcus or streptococcus bacteria, secondary to a cutaneous lesion. So this cellulitis also most of the time occurs due to staphylococcus or streptococcus bacteria, and if you see the cellulitis description, most of the time you will see cellulitis infection on the skin and subcutaneous tissues. So what do you need to check if you want to code for skin infection conditions? So assign an additional code from category B95 to B97 for organisms if applicable. For example, if the patient is having infection, staphylococcus infection, okay, or otherwise painful abscess. Here you need to code painful abscess first. That painful abscess is caused by staphylococcus. These staphylococcus codes are from B95 to B97. So along with painful abscess ICD-10 CM code, also you need to code B series code for staphylococcus infection. For that you need to use B95 to B97. And also in order to code to the highest degree of specificity of skin infectious condition, documentation should include what is the condition, what is the exact condition, whether it is abscess, carbuncle, furuncle, cellulitis and lymphangitis. And also in the documentation you need to check for laterality, whether it is right side of the body, left side of the body, or documentation does not have any specificity related to laterality of these conditions. Next, whenever you want to code these ICD-10 CM code, you need to check for the anatomical site, whether it is on the face, neck, trunk, axilla, upper limb or lower limb, hand or finger, foot or toe, other site and unspecified site. And also whenever you want to code these diagnosis codes using ICD-10 CM, you need to check causative organism, whether it is Streptococcus, Streptococcus pneumoniae, MRSA and MSSA, Mycoplasma pneumoniae and Klebsiella pneumoniae, E. coli, Haemophilus influenza, Pseudomonas, Helicobacter pylori. So among all these, you will encounter most of the time Streptococcus, MRSA, E. coli and Helicobacter pylori. So these are the details. If you want to know latest updates in medical coding, please join our WhatsApp group link. And also if you are looking for any type of surgery training, IPDRG, HCC, CCS training, please send WhatsApp message to 707 5263939. So next one is dermatitis. Okay, so dermatitis means inflammation of the skin. Derma means skin basically. Itis means infection. So infection of the skin is called dermatitis. Okay, so most of the time as usual it will be caused by infections, allergies or irritating substances. Okay, so most common dermatitis types we will encounter in medical coding is atopic dermatitis, allergic as well as irritant contact dermatitis. So what are the symptoms of dermatitis? These are the symptoms: rashes, blisters, dry cracked skin, redness, swelling. Okay, so what are the common tests in order to find cause of this dermatitis? Clinical examination, skin biopsy as well as skin patch test. Okay, next we will let dermatitis treatment options. So in order to treat this dermatitis, most of the physician will use antihistamines, cortisone type creams, dry skin care and oatmeal baths. Okay, in ICD-10 CM, as we have discussed previously, we are having various types of dermatitis. So it is the classification of dermatitis. So atopic L20, seborrheic L21, diaper L22, allergic contact L23, irritant contact L24. So like this, based on type of dermatitis, we are having separate set of ICD-10 CM three category codes. So just try to remember, whenever you see L starting word or starting letter, you need to think these L related to integumentary system or integumentary system conditions. Next one is skin ulcers. So what is skin ulcer? Skin ulcer is an open wound that develops on the skin as a result of injury, poor circulation, nerve damage or pressure. So here is the skin ulcer. Okay. So most of the time this skin ulcer due to injuries. Okay. So basically skin ulcer is an open wound. Okay, so this is not an inflammation, this is an open wound. Okay, now we need to understand what are the types of skin ulcers. Okay, so pressure ulcer, otherwise decubitus ulcer. So both are same basically, pressure ulcer or decubitus ulcer, due to constant pressure or friction on the skin. Okay, so most of the time we will see pressure or decubitus ulcer to the patients who are bedbound for longer durations, or patients who are having chronic conditions, and also non-pressure chronic ulcer. So damage to the valves inside leg veins prevents blood flow return to the heart. Okay, so here also these are non-pressure chronic ulcers. So these ulcers will not occur due to pressure. That's why they have classified it as non-pressure chronic ulcer. Okay, so the reason for non-pressure ulcer: damage to the valves inside leg veins. Okay, chronic venous hypertension, varicose veins, post-phlebitic syndrome, post-thrombotic syndrome, and also these non-pressure chronic ulcers occurs due to arteries fails to deliver oxygen rich blood to the lower limbs. Okay, so just here you need to remember, most of the time, so pressure ulcer occurs on the buttock area. Okay, non-pressure ulcer most of the time occurs on the legs or lower limbs. Okay, if the patient does not have enough oxygen to lower extremities or lower limbs, patient will encounter atherosclerosis of lower extremities, diabetic PVD. PVD means peripheral vascular disease, vasculitis or renal disease. So these are the conditions occur due to non-pressure ulcers. Next we need to understand skin ulcers. So most of the time skin ulcers occur due to peripheral nerve damage. Like common examples for skin ulcers are diabetic neuropathy and neuropathy. Okay, so what are the important thing we need to remember here? Ulcers are three types: pressure ulcers or decubitus ulcers, next non-pressure ulcers, and next skin ulcers. Next, if you want to code these skin pressure ulcer stages, you need to understand the stage. Okay, first one is unstageable, can't determine the stage. Stage 1, pre-ulcer skin changes limited to focal edema. Stage 2, abrasion, blister or partial thickness skin loss. Okay. Stage 3, full thickness skin loss involving necrosis of subcutaneous tissues. Stage 4, necrosis of soft tissues involving muscle, tendon and bone. Next one is deep tissue damage, injury to deep structures. So if you want to code skin pressure ulcers, you need to remember these stages. Based on keywords like abrasion, full thickness, necrosis, you need to code these pressure ulcer stages. So these are the pressure ulcer stages. Okay. Next, signs and symptoms of complication, diagnosis and treatment of pressure ulcers. So most common signs and symptoms are swelling, redness, tenderness, pain, skin discoloration, changes in skin structures, skin texture, yellow or green pus. And what are the complications? Because of this skin ulcer, patient will have bone infections, joint infections, cellulitis as well as sepsis. So sepsis is the blood infection basically. So next, how does a physician will identify pressure ulcer or skin ulcer? So in order to identify skin ulcers, physician will perform first clinical evaluation. He may perform blood test, tissue or fluid culture and imaging test using X-ray, CT or MRI. So what are the treatment options? So every condition is having the number of treatment options. Okay. So whenever patient or physician wants to treat any type of condition, most of the time he will start with non-surgical treatment. If the non-surgical treatment is not successful, physician will go ahead with surgical treatment. So what are the non-surgical treatment options for ulcers? Leg elevation, dressing, antibiotics, analgesics. Okay. So what are the common surgical treatment for ulcers? Debridement and skin grafting. So this is the skin grafting basically. So how do you check for documentation in order to code pressure ulcer? Okay. So pressure ulcer otherwise called as bed sores, decubitus ulcer, plaster ulcer, pressure area or pressure sore. Okay. The name itself indicates this ulcer caused by pressure. Okay. So other name for pressure ulcer is bed sores or decubitus ulcer. Most commonly you will encounter bed sores as well as this decubitus ulcer in the live coding. Okay. So assign as many codes from L89 category as needed to identify all the pressure ulcers the patient has if applicable. Okay. And also highest stage should be sequenced first followed by lowest stage if multiple sites of ulcers are present in the same encounter. So for example, if the patient is having multiple ulcers in the multiple locations, as we have discussed previously, pressure ulcer stages, we need to code highest severity or highest stage pressure ulcer first by next lowest severity or lowest stage pressure ulcer. Okay. In order to code to the highest degree of specificity, pressure ulcer should include the documentation of fourth character of anatomical site: elbow, upper back, lower back, sacral region, hip, buttock, ankle, heel or other sites such as head or unspecified site. Okay. First, whenever you want to code pressure ulcer, we need to check for degree or stage. Okay. And next we need to check for the location or anatomical site of the pressure ulcer using the fourth character. Fifth character is laterality. So whether it is right, left or unspecified. Okay. So sixth character is stage. So sixth character 0 means unstageable. 1 means stage 1, 2 means stage 2, 3 means stage 3, 4 means stage 4, 6 means deep tissue damage and 9 means unspecified stage. Okay. Don't confuse unstageable different, unspecified stage is different. So if you have any doubt after watching this video, please mention in the comment section of this video. So far we have learned up pressure ulcer. So now we need to learn or understand non-pressure chronic ulcer. So the other name for non-pressure chronic ulcer is chronic ulcer or non-healing ulcer or non-infected sinus of the skin, trophic ulcer or skin ulcers. Okay, here also we need to assign as many codes from L97 category based on the anatomical location. Here also we need to code highest severity, sequenced first followed by lowest severity. Okay. So here also force to character includes anatomical site, thigh, calf, ankle, heel, midfoot, other part of foot such as toe, other part of lower leg and specific part of lower leg. Okay. Next we need to understand non-pressure ulcers also we are having fifth character. So like pressure ulcer fifth character, here also fifth character indicates laterality of the non-pressure chronic ulcer. Okay. So right, left and unspecified, and as usual sixth character severity. So basically if you see pressure ulcer we are having 5 or 6 stages. Here we are having 9 categories. So 1 means limited to breakdown of the skin. 2 means fat layer exposed. 3 with necrosis of the muscle. 4 with necrosis of the bone. So basically these are the keywords in the documentation you need to check. For example, the documentation contains skin ulcer. Okay. So skin ulcer is a non-pressure chronic ulcer. So for that condition, you need to check all these keywords in the documentation. Okay. For example, if you see documentation contains ulcer with bone involvement without evidence of necrosis. So you need to use sixth character 6. So now we need to understand pressure ulcer coding guidelines. Okay. So pressure ulcer stages, if the provider not documented stage of the ulcer, code appropriate stage from other clinicians documentation. Okay. For example, physician documentation does not have pressure ulcer stage. So we can consider pressure ulcer stage from nurse notes also. Okay. So if pressure ulcer stage is not documented, assign appropriate stage from clinical documentation. So what does it mean? So basically here you need to check for these keywords. If the documentation contains with necrosis of the muscle, you need to code it as 3 or sixth character 3. Okay. So like that, if the stage is not mentioned, you need to check for these keywords. Next, pressure induced deep tissue damage should be coded with 0.6 from category L89 point. Okay. What is unstageable pressure ulcer? So unstageable pressure ulcer should be coded based on the clinical documentation only. Stage can't be clinically determined. If the documentation does not have, or if the patient is unable to stage the pressure ulcer, we need to follow this guideline. When there is no documentation of stage, assign code for unspecified pressure ulcer stage. So as medical coding basic thing is we can't assume anything. So for everything whenever you want to code, documentation is mandatory. So without documentation you can't code anything. Okay. For example, if the pressure ulcer is documented as healing, so healing pressure ulcer should be assigned the appropriate ulcer stage code based on the documentation. Okay. So if the documentation does not provide the ulcer stage, assign the code for unspecified stage. Okay. If the documentation is unclear, we need to provide the physician, or we need to query the physician or provider. So pressure coding guidelines, one stage pressure ulcer evolves another stage during the admission. Okay. For example, if the patient is admitted with one stage of the pressure ulcer and it's progressed to a higher stage, so we need to code two separate codes should be assigned. Okay. First code for the site and stage of the ulcer on admission. Okay. So the stage on the admission, and next code is the a second code for the same ulcer site and the highest stage reported during the stay. Okay. For example, if the patient admitted with first stage pressure ulcer and after few days this evolves into second stage. First you need to code first stage which is on the admission, and also you need to code second stage which is or occurred during the stay. Okay. So the documentation contains heel pressure ulcer, you can't code any code. Okay. So no code is assigned for completely heel pressure ulcer. Next we need to understand non-pressure chronic ulcer guidelines. So heel non-pressure chronic ulcer. So no code is assigned if the documentation states that the non-pressure ulcer is completely healed. So whether it is pressure ulcer or non-pressure ulcer, if it is healed, we can't code. Okay. So non-pressure ulcer documented as healing. If the patient documentation contains healing non-pressure ulcer, should be assigned the appropriate ulcer code based on the documentation. Okay. So if the documentation does not provide the severity of the ulcer, assign the code for unspecified severity. So based on your client guidelines, okay, if you are having the opportunity to query the physician, you can query what is the severity. The documentation is not clear, query the provider. Okay. So non-pressure ulcer that progress to another severity level during the admission. Okay. If the patient is admitted with one severity of non-pressure ulcer, progress to higher severity level. Two separate codes should be assigned. So same guidelines which we have used for pressure ulcer, we need to use for non-pressure ulcers also. Okay. So these are the most common three category codes for some of the integumentary system conditions. For example, if you want to code for abscess, furuncle, carbuncle, your three character is L02, cellulitis L03, pilonidal cyst L05, dermatitis L22, L30 categories, acne L70, pressure ulcer L89, non-pressure chronic ulcer L97. So now we will see few example scenarios. So a patient is admitted to the hospital with left ankle ulcer with fat layer exposed. In the hospital, ankle ulcer is treated with IV antibiotics and proper dressing to the wound. As soon as we see fat layer exposed, we need to understand that this is not a pressure ulcer. This is a non-pressure ulcer. Okay. So here we need to code L97 series. L97.322 non-pressure chronic ulcer of left ankle with fat layer exposed. So why means these fat layer exposed, all these are keywords for non-pressure chronic ulcer. Okay. Next example. So the patient was seen for the treatment of fine rashes on his trunk and upper extremities over the last 3 to 4 days. So the patient was diagnosed with hypertension a week ago and he started Ramipril 10 milligrams daily. In addition, the physician prescribed a topical cream for the localized dermatitis, which developed due to Ramipril medication. Okay. So basically, here patient is using medication for hypertension. Okay. But because of this Ramipril, patient is having ulcer. Okay. So that time we need to code condition first or condition which occurs due to adverse effect are the Ramipril as well as the what is the purpose of this medication. What is the use of medication or Ramipril? So the use of Ramipril is for hypertension. Okay, first condition which occurred due to adverse effect. Next we need to code for adverse effect, and next we need to code for condition for which physician has used or patient has used the drug or medication. So okay guys, I hope this session is very helpful. So if you are having any doubts, please mention in the comment section of this video. And also if you are looking for any jobs in India, USA or UAE, join in our WhatsApp group. And also if you like this session, please click on like button. And also if anyone looking for same day surgery coding training, IPDRG training, SCC training or CCS training, please send WhatsApp message to 707-526-3939, where you will get complete information related to medical coding free CUs as well as medical coding jobs in USA, India and UAE. So if you are having any complications or understanding these concepts, please mention in the comment section so that I can try to help you to better understand. So thank you guys. Thanks for attending our medical coding channel. And also if you are looking for free medical coding, just go to Fast Coder 21 YouTube channel, and these are the playlist for medical coding. If you want to learn CPC, just use this CPC playlist. If you want to learn inpatient IPDRG, just click on this inpatient IPDRG. If you want to learn modifiers, you need to use modifiers playlist. If you want to learn SCC coding, you need to click on SCC coding playlist. Okay. So once again, thanks for visiting our channel. So if you like this session, please click on like button in order to motivate me to provide more videos like that, which will help you to master in medical coding. Okay. So thank you guys. Have a good day.